CPT is a crucial aspect of the rehabilitation process for individuals who have had TBIs. Communication partner training can help improve communication outcomes and enhance the overall quality of life for individuals with a TBI. In this video, we will demonstrate 3 approaches: interaction-focused, communication-focused, and psychosocial-focused.
The goal of this session is to improve the patient's ability to maintain convos and have their communication partner support their social interactions. So for this demonstration, we're going to have the patient, their spouse, and their neighbor who's off camera right now, and they are going to talk about a summer barbecue in their neighborhood.
Hi neighbor, good to see you. Are you excited for the barbecue?
Hi, yes I am. I look forward to it every year. Do you guys know what you're bringing yet?
Yes, we will bring.
Yes, do you like potato salad?
Okay, so there's a couple of things wrong that you just did. First, remember, you got to let your spouse talk. You can't be cutting them off and jumping into the conversation, right? And also, you did ask a yes or no question. So can you think of any open-ended questions that you could have asked that would have made the conversation flow a little bit better?
I could ask why they look forward to it every year.
Yeah, that's a good question.
Thanks.
And now we're going to do a correct scenario.
Hi neighbor, good to see you. Are you excited for the barbecue?
Yes I am. I look forward to it every year. Do you guys know what you're going to bring?
Yeah, we always bring potato salad.
Nice.
Why do you look forward to it every year?
I really love potlucks.
So we will now demonstrate the communication-focused approach. This approach places more emphasis on implementing and improving the communication skills with the use of compensatory strategies. And again, we have our patient and their spouse who are going to demonstrate how a session would go. Okay, before we start our session, can you tell me some of the compensatory strategies we've worked on?
Using my notes app for memory aid, my communication book for visual aids, and my physical planner for everyday stuff.
Okay, awesome. So now your spouse is going to tell you about the day's events, and I want you to try to remember and see what you can do after I ask you some questions later.
Okay.
Okay, so at 8, we have to drop off the kids at school. At 10, we have to pick up your medication. At 12, we have lunch with my parents. At 1, we have your speech therapy appointment. And at 2, we have to grab the kids.
Okay, got it.
Okay, do you remember that?
Yeah.
When is your speech therapy appointment?
10.
Are you sure about that?
Yes.
Okay, so you did not use any of your compensatory strategies. So this time we're going to try it again, and I want you to use some of those strategies we just talked about to help you remember, okay?
Okay, I can use my notes app or my calendar to help my memory.
Okay, so now we're going to do the correct scenario. And Lauren, are you ready with your notes app?
Yes.
All right, let's let Alyssa tell you about your day's events.
Okay, so at 8, we have to drop off the kids at school. At 10, we have to pick up your medication. At 12, we have lunch with my parents. And at 1, we have your speech therapy appointment. And then at 2, we have to pick the kids up.
Got it.
All right, and what time is your speech therapy appointment?
1.
Perfect. Now we're going to demonstrate the psychosocial approach. This session is about addressing the psychological and social aspects of communication difficulties the patient is having. It considers the emotional well-being, self-esteem, motivation, and social relationships of both the patient and their communication partners. And again, we have our patient and their spouse. Thank you guys both for being here. Today we're going to discuss some of the emotional and social challenges that can arise following a TBI. So can you guys introduce yourselves to me, please?
Hi, I'm Alyssa. My spouse had a TBI a couple years ago, and communication has been tough since then.
Hi, I'm Lauren. I had a TBI a few years ago. I agree, I just get so frustrated now, and I just get mad now. I'm anxious when I have to speak.
Thank you guys for sharing. With the TBI, the changes in our brain function can affect our moods, behavior, and relationships. We can go over some mindfulness techniques and relaxation practices to help you when you get, those feelings and those negative feelings you feel.
We would love that.
Okay. So there are a few things you can do to kind of ease that anxiety you have towards speaking. You can do some journaling. You can focus on your breathing or listen to some lo-fi music without lyrics. You want to just be in a rested state, a mindful state. You can take some walks out in nature, nothing too strenuous. And also there is a website called Love Your Brain, which is a evidence-based practice yoga/meditation website that you can turn on. And if you have 5 to 10 minutes free time, you can turn on a video and just do some of that mindfulness and some of that yoga to help ease your behavior and your moods.
Thank
Thank
you.
you.
These 3 demonstrations were all a part of step 3 in the social communication training framework that we discussed in our presentation. Following these structured settings, the next step is step 4, refine and transfer. In this step, more advanced or nuanced social interactions and communication aspects are applied from before. To practice this technique, sessions would be comprised of review of guiding principles and incorporating group feedback and homework to make sure everything that we're working on is generalizing over to real-world settings. For example, in the first scenario we had about the summer barbecue, step 4 would look like trying to record an interaction with somebody to review in the therapy setting, to critique and discuss in a group to make sure not only the patient understands what we're working on, but the spouse also understands some of the things that were worked on as well.